Welcome to this explainer. Today, we're going to do a complete 180 on how we think about chronic kidney disease, or CKD. Look, if you or a loved one has recently been diagnosed, I know you're probably feeling incredibly overwhelmed. But what if I told you that the very first thing most people focus on is actually completely backwards? Seriously, we're going to break down the real medical priorities, step by step, to help you take true control of your health.
Picture this. You're sitting in the doctor's office, you just got the diagnosis, and that immediate, sinking sense of panic sets in. And almost without fail, the very first question people ask their doctor is, I have CKD. What should I eat? It totally makes sense, right? Dietary restrictions are kind of infamous when it comes to kidney disease. People instantly start sweating about cutting out salt, restricting their protein, or literally changing their entire lifestyle overnight.
Okay, let's dive into this. Think of this moment right here as a giant medical stop sign. Jumping straight into some restrictive diet plan before doing anything else? That's a fundamental mistake. Before we even utter the word food, we have to ask two absolutely vital questions. Have you identified the exact cause of your kidney disease? And do you actually know your current status? Because without that foundation, any treatment you try is just a shot in the dark.
So here's our roadmap for the explainer today. We'll start by grasping cause and status. Then we'll hit our three main goals: preventing dialysis, protecting the heart and brain, and preventing a bedridden state. Finally, we'll wrap up with finding your own unique treatment plan.
All right, let's jump straight into Section 1, grasping cause and status.
This right here is the absolute prerequisite phase. You see, the root causes of kidney disease vary wildly. If your CKD is caused by diabetes, your top priority isn't some generic kidney diet, it's strict blood sugar control. If it's high blood pressure, you gotta manage that blood pressure. If obesity is the trigger, weight loss is your main therapy. And hey, if you have an immune disorder affecting your kidneys, a simple diet and exercise routine won't fix it. You need specific immune therapies. A one-size-fits-all approach, it absolutely does not work here.
Right alongside the cause, your doctor has to map out your exact stage, and they do this by looking closely at two specific things: eGFR and proteinuria. Think of your eGFR as a snapshot of your present reality. It tells us exactly how much kidney function you have right now. Proteinuria, on the other hand, well, that's like a crystal ball for your future. The amount of protein in your urine helps predict if your kidney function is likely to rapidly worsen down the line. You have to understand both to know what needs treating first.
Moving on to our first big goal, Section 2, prevent dialysis.
And this brilliantly illustrates the biggest fear most newly diagnosed patients carry. Look at these numbers from Japan, which give us a fantastic statistical baseline. There are roughly 13 million CKD patients over there. But out of that massive number, only about 300,000 are actually on dialysis. That means a staggering 97% of CKD patients are not on dialysis. To put that into perspective, only 3 out of every 100 end up needing it. Now, preventing dialysis is obviously a vital goal, but I'm hoping this data lifts a huge weight off your shoulders.
Okay, let's shift gears to Section 3, protect heart and brain.
Prepare yourself, because this is the massive plot twist of this whole explainer. The real, primary threat to CKD patients, it isn't always the kidneys themselves. It's actually the heart and the brain. Folks with chronic kidney disease have a 2 to 3 times higher risk of developing severe cardiovascular and neurological issues compared to the general public. In fact, tragically, more CKD patients pass away from heart attacks and strokes than ever make it to dialysis. Protecting your vascular system is absolutely critical.
So what's actually driving these heart and brain issues? Well, it usually boils down to arterial stiffness and atherosclerosis, which are fueled by 5 major lifestyle and health factors: high blood pressure, diabetes, high cholesterol, smoking, and a lack of exercise. These 5 culprits are responsible for the vast majority of cardiovascular events in kidney patients. If you really want to protect your kidneys, you have to ruthlessly target these 5 risks.
To combat this, a good doctor won't just blindly throw medications at you. They're going to run specific vascular tests to evaluate your unique cardiovascular risk. Take the carotid echo, for example. It uses an ultrasound on your neck to literally look for plaque and stiffness near the brain. Then there's the ABI, or blood pressure pulse wave, which effectively measures your overall vascular age. And of course, checking your LDL cholesterol levels. These actionable tests tell your doctor exactly how aggressively they need to step in and protect your heart and brain.
This brings us to our third big goal, Section 4, prevent a bedridden state.
Now, this is an incredibly important pillar, especially for our growing elderly population. We really need to talk about sarcopenia.
Simply put, this is the severe age-related loss of skeletal muscle mass and physical strength. When you combine older age with chronic kidney disease, physical function can drop to just 70% of a healthy person's baseline. For individuals in their 80s with kidney disease, nearly 30% are at a dangerously high risk of becoming bedridden or unable to manage their daily life. So preventing this muscle loss, it's a massive priority.
Now, what's really interesting about this slide is the massive contrast in how we treat different people. On the left, we've got a young patient whose CKD is driven by diabetes. For them, a strict diet and intense intervention to stop kidney decline is priority number one. But on the right, look at the 75-year-old frail patient who's losing weight. Actually, scratch that. If we put them on that same strict low-calorie, low-protein kidney diet, we could seriously harm them. For the elderly patient, eating more to maintain calories and prevent muscle loss is the actual medical treatment.
This huge realization has sparked a new gold standard in nephrology known as kidney rehab. Doctors are now heavily focused on combining targeted physical exercise with personalized nutrition that's specifically designed to build muscle. Clinics are even using cutting-edge tools like in-body scans to precisely measure a patient's muscle and fat mass while tracking their grip strength and overall physical function. For older patients, kidney rehab is exactly how we fight back against sarcopenia.
Finally, we've arrived at Section 5, Finding Your Own Treatment Path.
Okay, it's time to bring all of this together. So the crucial point is this: your treatment must be as uniquely yours as your fingerprint. You simply can't rely on generic internet advice. You need to partner closely with your primary care doctor or nephrologist. Step 1. Nail down your specific root cause and your exact stage, using your eGFR and proteinuria. Step 2. Figure out which of our 3 goals, preventing dialysis, protecting the heart, or preventing muscle loss, is your highest personal priority based on your age and health. Step 3. Build a customized plan together based on those specific answers.
I want to leave you with this final provocative thought. Right now, do you know your exact medically personalized treatment goal? Or are you just kind of guessing, relying on some generic kidney diet you stumbled across online? Listen, if you don't know your specific priority, please make that the very first question you ask at your next doctor's visit. Because when you take control of the facts, you take true control of your health. Thank you so much for joining me for this explainer. Keep asking those right questions, and I'll catch you next time.